This is part 4 of the series on what went wrong and sort of a chronology of the coronavirus. Now, just to recap, in early 2020, it became obvious that there was a problem in Wuhan, China. And the Chinese authorities at first were overly circumspect. They're paranoid in some respects in terms of the political authorities, in terms of revealing the extent of the outbreak of infections that had occurred. Chinese doctors, on the other hand, behaved with considerable bravery and honor. And so there was that going on politically. And at the same time, the WHO, which was in contact with Chinese authorities, was sort of caught between trying to play the role of diplomat and trying to play the role of health organization. And so it sort of stonewalled as well on the whole issue of how severe the infections were. Now, the second country that was infected was South Korea, and that outbreak, as I mentioned before, was in Daegu. The South Korean authorities were initially caught off guard, but they did have a plan in place, and they responded very quickly, as the Chinese were starting to do in Wuhan. However, as the virus started to spread internationally, mainly because of air travel, other countries were not in the same sort of situation of preparedness. For example, Canada had an emergency pandemic response team, which mysteriously the government had dissolved sometime earlier in an act of absolutely staggering short-sightedness. And similarly, the United States didn't really have a clear plan. The Trump administration behaved with a kind of sort of bigoted wishful thinking, and it started banning flights from China, which was basically too late to have any kind of effect. In the cases of both Canada and the United States, there was a general failure to close airports quickly enough, to close borders quickly enough, whereas in other countries, a few other countries, for example, China, mainland China, Taiwan, South Korea, Japan, and so forth, New Zealand, Australia, there was a quicker movement toward closing borders and trying to contain the epidemic. Now, through March and April, there was still a lot of doddering in Canada, and there were absolutely extraordinary acts of stupidity that occurred. For example, there was a mask shortage internationally, and in Canada there was a warehouse filled with N95 masks, and they had gone past their technical past due date. These masks don't actually wear out the way vitamins do. And the problem wasn't with the masks themselves, which are inert and were perfectly fine. The problem was the elastics were getting a little bit aged. So some genius in charge of those masks for the Canadian health authorities just chucked them out. This exacerbated a situation that was existing in Canada already with a mask shortage and very confused messaging over the efficacy of masks. In South Korea, on the other hand, there was a recognition that masks were helpful and important, but there was a shortage, and so rationing took place. In other countries, parts of Europe, the United States, there was just sort of a reaction against masking altogether. That helped exacerbate the situation. Now, throughout 2020, there were no vaccines available. Starting in the summer of 2020, the Chinese started doing trial tests on a vaccine that they had. But these were massive trials, and in effect, they were starting to inoculate their population. The Chinese vaccines are sort of more traditional in the sense that they are a weakened live virus. The Western approach was to emphasize mainly mRNA vaccines, which are very, very effective. But that was a new technology, and of course that became a problem in terms of the paranoia of sort of the not that well educated or simply not very intelligent elements of the population. And as well, there was a good quality vaccine from a Western company, AstraZeneca, which was more sort of similar to that traditional approach to vaccine production because of political tension between the United States and China, and also between Canada and China. There was very little vaccine cooperation at a time when that would have been helpful. And so the situation just sort of lurched along throughout 2020. And it wasn't until the very end of 2020 and early 2021 that vaccines started to become widely available. But again, there were problems with distribution, and there were big problems with hoarding.